Hey there, Stephanie Joy with all things Social Security and the law practice of Joy Disability. Here's a short little segment from our recent live stream Q&A that we have every Wednesday at 1 p.m. Eastern Standard Time on the YouTube channel, All Things Social Security. Enjoy, and if you have any questions, leave them down below in the comments, and I will be sure to get to them. Thanks so much. Bye-bye now.
Hey guys, how is everybody? Shiloh, I see you are here bright and early with 5 million questions. We'll see. We'll get through them, but we'll probably jump around because I don't want to make everyone else not be heard. Are you? Dimple's in the house. Dimple says yes, she can hear us. Okay, good. Guys, you know Shanna Justice of Justice Disability. Shanna's in Kentucky, right? And Shanna, do you see the postings part? The
comments, yeah, I see them.
Yeah. I mean, if you want to put your website in there, so if anyone wanted to reach out to you, feel free. You know, you could just type it right in there. It'll come up on the page. Do you see what I'm saying?
Yeah, it'll let me.
Okay. Anyway, so Shanna's been here before a couple times. So we're gonna share your questions, and you can see maybe a couple different perspectives and stuff like that. All right, so let's go back up to the start. I'm going to start with Shiloh. Again, I'm going to probably, Shiloh, depending on how that rolls, because I know you got a lot of, it looks like maybe function report questions. Yep. I don't want to use the whole 2 hours for that because I don't think it would be fair, but we'll try to hit on some and in a way that, you know, would be helpful to other people. I also wanted to add, guys, we just got the waterfall chart for 2025, and I'm going to probably do a video on it because I think it's just important to know. And by way of explanation, the waterfall chart, it's put out by the SSA information, and it shows you how, because people are always asking, how many people win, it's very broad though, win on initial, and how many are denied. And that encompasses everyone, represented, unrepresented, old, young, nothing specific. And then the waterfall goes down because some of those people that are denied, right, appeal for reconsideration. Not all of them. We know plenty. Shanna, you probably had them where you got someone who said, well, I applied and then I got denied, so I gave up and now I'm trying again. So yeah, those people are not included in that next waterfall down to recon. And I don't know what the percentage are that do appeal for recon. I don't know if they give us that. That would be interesting to know though, I think. So what percentage of the people that were denied an initial that went to recon then win, which is a smaller amount. And then of those people that are denied on recon and go to ALJ, how many of those prevail? I will say the big takeaway was, and I got this from, I forget if it was Nosker or Nader, that it's basically the same as 2024. And I think the big point of that is they actually had far more cases because they started speeding things up a little bit and using some technologies to make things go faster and maybe better placement of employees and stuff like that. So they had a lot more cases, but the percentage of wins losses didn't change because people were like, they're gonna deny everybody. I'm like, where do you get that stuff? That clickbait stuff is not your friend. So what even the big organization was saying was it looks like it's about the same in terms of where they all fall. And so then, you know, I guess every year they put it out. I've only gotten my hands on it sometimes. So sometimes it's harder to find. And I used to get it from some place, I think it was out of New York, like Empire or something. But now Nosker shared it. So that was kind of cool. Are you familiar with that one, Shanna? Yeah. I'll send it to you.
Yeah. Okay. Well, I'm looking at it though. Yeah.
Yeah, it's good. I'll end up posting it probably someplace on the channel, maybe for the members or something, you know. But I'll definitely do a video on it. All right, so Shiloh wants to talk about the adult function report. People are always interested in that anyway, since everyone's got to go through it pretty much, barring very, very few. I've had a few cases where the person's, I think because they thought the person was going to meet maybe a compassionate list, you know, compassionate allowance. Have you had that, Shanna, where they're like, I maybe had it like twice in 20 years, where the adjudicator's like, well, I'm thinking if we get this medical evidence, we don't need his function report, you know? And that would only be if they have a listing, right? I mean, otherwise they have to because they have to do it RFC. All right, so Shiloh says, adult function report for PTSD claim, question number 20. Just to remind everybody, question number 20 is with all those, it's like little chart of tasks, you know, lifting, sitting, standing, walking, stair climbing, blah, 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 understanding, following directions, getting along. That's number 20. And he goes on to say lifting, squatting, bending, standing, reaching, walking, sitting, as I was just saying, and all those. And then I guess his second thing is concentration, understanding, following directions, like I just said, and getting along with others. Can you help with that question? You would have to tell me what in fact you need help on with that question. I could give you some generalities, Shiloh. First of all, is there anything that you would say to him?
Just need to be descriptive as to what of those things that you have problems with? Like, do you have problems sitting? If so, how long can you sit before you need to get up? If you can't lift more than a gallon of milk, tell that. If you can't stand for more than a few minutes, you just need to be, descriptive as to the problems that you have with those issues.
Yeah, I agree. And I would add that if you're thinking, well, I can do that, therefore, language of the question is something like, are these affected or limited or whatever? I see some people not check things off because they're like, I'm able to do that. And that's not really the question. The question isn't, are you able to do it at all? The question is it affected by your conditions? And by the way, old age degeneration is a condition, guys. So don't say, well, that's just because I'm 55, No, that counts. The beauty of it counts. This doesn't have to be from some disease or known injury or anything like that. Our degeneration as we get as old as I am is a real thing. I cannot do probably 60% of what I used to be able to do. Because I was a pretty strong person. And even like 2 years ago when I did this fitness challenge, I got really in shape. And then that's been 2 years. And now I'm kind of back to. So it's kind of like something you got to keep using it or losing it. So that's one thing I would say. And a way to look at it in your mind, and you guys have heard me say this probably a gazillion times, if you can't do any of those tasks for as long, comfortably, or as repetitious, without any kind of discomfort, as you could when you were 20, there's something there. And the question is, you don't even have to know exactly what it is that's wrong with it, necessarily. Just put it down. And if you have a decent representative, they're going to be looking at it. And they're going to inquire if they don't see an impairment that causes that. You've never said that your legs were weak, but you're saying, yeah, my legs get weak. Now they're going to know to say, hey, you need to follow that up with your provider. Maybe get a specialist, a neurologist, or someone's spinal, whatever that's going to be maybe affecting those legs. But you want to put that down, because if you don't put that down and that function report ends up going to an ALJ, he's going to note that you said that was not a problem. So even if you testify at hearing that you have all these problems, because now you've talked to a representative and you know that that's something you should have said, it doesn't look good that before you said no and suddenly you say yes. It's almost like you're just changing your mind. So it's definitely more helpful to put it down early on with that understanding that if it's a weakness or something that is not as good as when you were 20, back when we were like immortal and super men and women, that's what I would put down. That's what I would do. That's a broad thing, though, Shiloh, because I can't really answer to your specific case because I don't represent you and I don't know your case. Shiloh does continue on to go to say, I have to lay down a lot due to panic attacks. I also stop mid-sentence sometimes when talking to someone if I feel one coming on. I have to stop talking to get myself together. It feels like I'm about to vomit. It's embarrassing. Yeah, I can imagine. Do you want to add anything to that?
Again, just have to explain anything that you do that would be deemed as not normal, what any regular so-called person can do, and just needs to be explained how you do it differently or aren't able to do it and why.
Very good. Yeah. And she makes a good point, how you do it differently. Like if you do something differently than what the human body and mind wasn't originally intended for us to do, that I would explain, because that's kind of a workaround. And
because a lot of people will put on those paperwork that they can do dishes and they can do laundry, and the judges in the Social Security office assume that you can, if you just put that you can do it right all at one time and don't have any problems with it. It needs to be explained that yeah, you can do a load of dishes, but it takes you 5 minutes at a time. It takes you all day because you have to do a few minutes at a time and sit down, take a break, and then do some more. Or you have to do laundry and get somebody else to get it out of the dryer or put it in, out of the washer. Anything that you do differently than what a so-called normal person would do.
I totally agree with that. I know it's hard when it comes to the mental health aspects of it. Shiloh, I had just put out, you probably saw it, it was a number of weeks ago, how to deal with the function report if you have a mental health claim. Because some people think it's all physical and it's really not. And you pointed out a few questions yourself, Shiloh, that's in section 20 about memory, completing tasks. You've got it hands down for talking. I would be checking off talking, that your voice freezes up because it's part of, you don't even have to say what the diagnosis is. Just say suddenly, very frequently, I become unable to talk. You don't have to be the doctor and say, and that's because of this diagnosis. In fact, I wouldn't do that. Your your claimed impairments are already elsewhere. There was something else I wanted to say about that. That would obviously affect your concentration and your probably ability to complete tasks, Shiloh, because if you're out trying to go to the bank or something and you get this panic coming on where you can't think straight and you can't talk and you feel like you're going to vomit, I don't know if you leave the room, like, do you actually go and escape the situation and, take yourself out of the situation, which means you don't complete that task you were going to do in the bank? That would be completing tasks. I mean, it can be, more specific than that even. Let's see. Laying down due to panic attacks. You could say, and that would be something, I don't know, if your panic attacks are daily and that makes you, like, you're going to have them in the middle of the day. Do you have them at home when you're not even in the work environment? That's kind of important too, because that shows that would most likely then happen in work environment also. What else? And if so, it pulls you out of your day. You got to go lie down. Lying down is not a work-related posture. So that would be off task. So you're claiming something that would put you off task. And then, of course, the hardest part about it is getting that in your medical record as such. So you have to talk about all that with your mental health therapist. And if you're on medications or getting something prescribed by an MD or a DO or a nurse practitioner for mental health, anxiety, what have you, you want to make sure that talk therapy is pretty frequent, since you're saying it's a very serious condition affecting you every day, and give those details and say, I just really want, you can't really say, I want these details in my record because I'm filing for Social Security disability, unless she thinks that you should be filing for Social Security disability. If you expound on it enough, I think she'll at least, and probably you have anxiety in your sessions, is my guess. Hopefully she's a competent recorder. What do you find with that, Shanna, about